friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like I said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers, and I'm Angela Yarborough, and this is Dr. Jerry Yarborough. So I'm anxious to hear what we're going to talk about today.
Well, thank you. What we're going to talk about today is actually musculoskeletal disorder injuries in the workplace. You know that there's actually around 300,000 musculoskeletal disorder injuries in the workplace annually in just the United States.
Yeah, I was reading an article yesterday and it was talking about like pre-pandemic, there was like 5% people working from home, and after it's grown to like 25 to 30.
That's true. People have learned different ways of doing different things, and like 30% of people now in the U.S. workplace are actually working from home. So what we're talking about today is specifically workplace ergonomics, or seating positions, workstation positions that can lead to injuries. So that's exactly what we're going to talk about today. So again, we have our CFO, Tara Howington, and first we're going to look at the proper seating. Whether you're in the office or at home working, you need to pay attention because it can lead to injuries, okay? So I like to start off at the bottom. We're gonna start at the feet. Your feet have to be flat on the floor. No tucking your feet up under your chair, up on this thing, up on your toes, or having a footrest out in front of you where you're putting it up like that. And moving up from there, we're talking about the knee position and the hip position. Our knees need to be at a 90-degree angle, okay, as do our hips, okay? So you don't want your hips or your seat way high, because then that's going to increase the lumbar curvature of your low back and put stress on your low back. If your seat is too low, then your knees are going to be way up and you're going to be flattening that normal curvature of your low back. And you want this seat all the way back in the chair. Your chair should be deep enough for you to sit and have 2 to 3 finger widths between the back of your knee and your chair. Otherwise, you can cause a musculoskeletal injury here at the back of your knee. All right, so from your hip, then you want a good lumbar support to maintain a neutral spine in your lower back and good thoracic support for your mid and upper back, okay? The arm rest height should be just at the length of your arm with your elbows rested in good posture. You want your arms rested on the armrest. You don't want them too high to where your shoulders are up like this, and you don't want them too low to where you're having to slouch over to rest your arms on the armrest. And then your keyboard should be right here in the same position, okay? If your arms are out like this, your keyboard needs to be right here to where you're not having to reach out, reach up, or down to reach your keyboard, all right? As far as your computer screen, you're gonna want it at eye level, all right? You don't wanna have to be looking up or down or turning your head to the right or to the left. If you have multiple screens, again, you need to have them positioned in a way that you can sit comfortably looking straight on at your computer screens. All right, so come back after the break and we'll be talking about things you can do at home. Welcome back to Physical Therapy Thursdays on Louisiana Living. I am Dr. Jerry Yarbrough, physical therapist and owner of Physical Therapy and Balance Centers of Ruston, Jonesboro, and now El Dorado, Arkansas. So what we're talking about today is musculoskeletal disorders such as neck pain, back pain, shoulder pain, arm pain, wrist pain, injuries that are commonly caused in the workplace. We actually have 300,000 injuries each year in the workplace. So we're talking about now, after the pandemic, around 30% of the population or the workforce is actually working from home. So in the previous segment, I showed you proper seating, and now I'm going to give you some ideas of some modifications you can make for a home workstation to make sure your ergonomics are good and safe and keep you healthy, okay? So we talked about the arm and arm height for the keyboard needs to be at a resting position, not to where you're reaching out or up or down. So what works good is, like, we have this lap desk that you can put in your lap, and your keyboard can actually sit here. Most people at home are working on a laptop. So you can have a wireless keyboard or even one that goes up to the keyboard. You have your desktop, and you're going to want to get either a laptop station or devise one out of books or something at home that will get your computer screen again at eye height and straight in front of you. You don't want to have to be turning your head for long periods of time, looking up or looking down. Everything has to be at a good height. So laptops are great, they're very portable, but you're going to need to have a keyboard. It's going to need to be in your lap or at a height that works in the situation like this, okay? Some other things that you can do immediately to help you recover from musculoskeletal disorders is take frequent rest breaks. Every 20 to 30 minutes, you need to get up from your workstation, whether you're at work or at home. Set your alarm, because I know how it is. You get busy, you just get into work, and 2 hours have passed and your neck starts hurting, and you need to set a little alarm to go off every 20 to 30 minutes to remind you to get up, walk around a little bit, or to do some stretches. And so, talking about stretches, I'm going to show you a couple of neck stretches, okay? So you're going to kind of stretch over to the side, hold it for about 10 seconds. The other side, 10 seconds. You're going to rotate your head, 10 seconds, other way, 2, and then bring your chin to your chest, and then looking up at the ceiling, okay? Those are good stretches. And then another good one is to push your chin straight back, okay? Just like that, okay? And you're gonna hold that for about 10 seconds and relax. And then also, as you get up, every 20 to 30 minutes, you're gonna wanna do a good back stretch like this, okay? and kind of leaning side to side. And make sure you're doing those things at least 20 to 30 seconds, and that you're getting up every 20 to 30 minutes. All right, so those are some great things that you can start doing immediately. And again, we're here every Thursday talking about impairments that affect your quality of life and how we can show you things that you can do immediately to help. So come back and see us next week, and thank you for joining us today.